everyone, welcome back to FACT Facial Assessment with Clarius Technology. I'm Dr. Roya Zarmezamin, and this episode is about botulinum toxin injection into the most powerful muscle in the face, which is Masseter muscle. Masseter muscle is very important because sometimes hyperactivity of the muscle, it causes bruxism and then a dental issue. And sometimes we are treating Masseter muscle with botulinum toxin for facial slimming. It's very important because this is the strong, thick muscle with tendon inside. Deep inferior tendon inside the muscle separate different area of the muscle and divide it to deep head, intermediate head, and superficial part. The deep part is for stabilizing the muscle to the bone. Superficial, it's for bulk and movement of the muscle, and intermediate is helpful for both sides. It's very important to target all three heads, not causing any paroxysmal hypertrophy. If some, like one of the heads just leave untreated, it might cause the hypertrophy and bulging. It's very important. Now I'm starting to assess the muscle and even the thickness of the muscle before clenching and after clenching. I can measure and I can document and start injecting under the guide. I'm using Clarius L20 linear probe and start from posterior part close to the ear, and you see that bone, mandibular bone, just on the bottom of the image, and parotid gland, the left side, which is the little cloudy, hazy structure. And I'm gliding anteriorly and see the thickness of the muscle. Now I'm going to measure the largest diameter, which is 10.87, and a screenshot. Then I'm asking my patient to clench, and now I measure and relax here, which is kind of 14, and now I'm just a little glide and trying. I see the deep inferior tendon separate in three heads. Posterior is a deep one, left side, then superficial on top, in the middle, and intermediate on the anterior part. Now I'm going to inject under the guide. I clean the face before I cover my probe with a sterile cover, and I'm going to scan with my left hand. And just clean this area and the needle and start injecting. Entering going inside, you see the needle is a little bit white, linear. I can even use the needle enhancement for more clearance of the needle. You see, I'm going anteriorly to the intermediate part, a little inject, and superficial part, and then go back and go deep to the deep part. As you see my needle, I can show you a little bit with the tilting. If I don't see the needle, I'm not moving my needle. I just move my probe to see the needle. You see, that's my needle. Go back a little deep and inject. This is the injection under the guide, and then after 2 weeks, I can check the activity and contraction of the muscle and measure again the thickness of the muscle before clenching and after clenching. Thank you for joining us for this episode and stay tuned for the next one.